been over 4 million confirmed coronavirus cases in the US, and demand for testing across the country only continues to grow. But not all Americans can get a COVID test when they want one. In many places, it depends on the color of your skin. Recently, ABC News and 538 examined who has access to testing in America. We found that in many urbanized areas, majority Black and majority Hispanic neighborhoods have far fewer testing sites per person than majority white neighborhoods, even accounting for income. That means that even among poor neighborhoods, Black and Hispanic communities still have fewer testing facilities than their white counterparts. And some of these disparities are truly staggering. Take San Antonio, Texas. Using census data, we could see how many people lived in different neighborhoods, as well as their demographics. Then, we used a list of known COVID testing facilities in America from June of this year to figure out just how many people a particular test site might have to serve. As a side note, you might think that the US government might keep a list of all the testing facilities available in America, but no such list exists, so we're using data from a healthcare platform called Castlight. Okay, back to San Antonio. When you isolate the majority white neighborhoods, you can see that they're predominantly shaded green, meaning that they have a higher number of testing facilities per person. Now, compare this to majority Black and majority Hispanic areas of the city. As you can see, these neighborhoods have some of the busiest testing sites. In fact, we found that expected demand for testing in Hispanic communities was twice as high as that in white communities, and the demand at testing sites in Black communities was even more than twice as high. San Antonio had a particularly wide disparity in testing access, but it's not the only major urbanized area failing to meet patient demand. A number of US cities are ill-equipped to handle the testing needs of their citizens, and the burden often falls disproportionately on people of color. Take the Miami area. On average, majority Black areas had a potential community need 13% higher than majority white areas. In majority Hispanic areas, it was 29% higher, with the densely populated, predominantly Hispanic neighborhoods around South Miami showing a particularly high potential need. By the way, it's important to note that we didn't account for actual need in our analysis. For example, we didn't factor in that essential workers in many places are disproportionately Black and Hispanic. So these areas are also likely to have more demand for testing, even as they have fewer sites per person. We also didn't account for the number of tests facilities were able to process, nor any restrictions on test availability, such as whether you need insurance. The results of these disparities are clear: longer commutes to testing sites, longer wait times, and understaffed facilities. In one predominantly Black neighborhood in Miami, for example, people are waiting 7 hours to get a test, and they're encouraged to show up with a full tank of gas since they'll be in their cars for so long. For many people, this means just not getting tested at all. So, why are we seeing this? In many ways, these testing disparities are the result of pre-existing inequalities in our healthcare system. The federal government has given little guidance to states on how to allocate tests. Many states ended up putting testing sites in existing medical facilities, and there tend to be more of those in wealthier, whiter communities. These inequalities are also apparent when we look at how the country has handled the pandemic as a whole. According to the COVID tracking project, Black people are dying at 2.5 times the rate of white people, and have already accounted for 23% of all COVID-19 deaths where race is known. Some urbanized areas are taking steps to address this problem. LA has recently instituted plans to help reduce some of the testing disparities. Back in late April, Governor Gavin Newsom began expanding statewide testing capacity, including setting up close to 100 state-supported testing sites in its communities of color and lower-income areas. And in early May, LA Mayor Eric Garcetti announced free COVID-19 testing for everyone in the county. Since these changes, the testing gap between predominantly white areas and predominantly minority areas shrunk from more than 65% to 24%. Without these expansions, we would have most likely seen an even starker contrast in this map. Many other cities have more recently started efforts to combat their testing disparities too. But with cases and hospitalizations continuing to rise, those efforts may be too little, too late.